Are you thinking of getting pregnant? And have you started taking your folic acid? Yes, you need to start taking folic acid before getting pregnant. 1 month before getting pregnant. But ideally, you need to take it 3 months before getting pregnant. Yes, I mean before getting pregnant, not when you are already pregnant. So today's video, we're going to be talking about the reasons why you need folic acid before getting pregnant. And I think you don't want to miss out on this episode of Talk Pregnancy with Dr. Noella, bringing to you action on preconception care. So let's go. Many women might have heard of folic acid when maybe they were pregnant, or they have someone who is pregnant around them and they take folic acid maybe during their pregnancy. That's the antenatal consultations. Yes, you are right. You're supposed to take folic acid during your antenatal consultations. But here we are talking about the importance why you need to take it before getting pregnant. And it is very, very useful before getting pregnant. What is folic acid? Folic acid is a type of vitamin B, which is vitamin B9. And this folic acid is what we call the synthetic form of what is known as folate. Folate is gotten from what you eat, and what you eat is mostly vegetables, green vegetables, beans, and maybe fruits such as banana, oranges, lemons. So you can get folate from this meal. But folic acid is a synthetic form. That's the man-made form of this folate. When you eat folates from these foodstuffs, it has to be converted to folic acid in the body, which helps in building of cells and it helps in the production of blood. Now, this folic acid does not only help in the production of blood, it also helps in brain development early during conception. That's when the egg and the sperm meets to start forming the baby. Early in life, that's about 1 month before you are even thinking that you are pregnant, or before you even miss your period. This layer that helps in forming the brain and the spinal cord are already being formed at that early age. This is what we call the neural tube. So the neural tube is what forms the brain and the spinal cord early after conception. So it's very important we know this. Now, everybody needs folic acid in the system. Everybody. Because folic acids help in the building of new cells in the body. But women, especially those in reproductive age and those planning to get pregnant, need it more. So if you're not able to get it enough in foodstuffs, and if you don't eat well, it's very important you supplement with folic acid. And you might not know if you are taking enough. So it's always better, it's always advised that any woman who wants to get pregnant, at least 3 months, you should start taking folic acid. What is this neural tube? This neural tube is just like a flat structure. You see a flat structure which after forms like a fold. You have 2 folds coming together and fusing. Within it, that's where we have the brain and the spinal cord. So above is the brain and below is the spinal cord. So if there is no enough folic acid present during that time of conception, the 2 folds that have to fuse together is not going to fuse completely, leaving part of the spinal cord out of the covering, like maybe the spine. You see the cord out of the spinal cord. That's if it happens below. If it happens above, you see a child without a brain, or the brain has not been formed completely. That is what we call anencephaly. That's the child without a brain. And most of the time, these children, they either die before they are born, that's like fresh stillbirth, or once they're born, within some few minutes they usually die. But if this fusion does not fuse completely at the lower part, that's at the spinal cord, that's what we call spinal bifida. So these things are happening, these things are present. Now this folic acid actually helps in the complete fusion of this neural tube. So if it is not formed, if it is not closed completely, that's what we call neural tube defect. So that is the importance of folic acid at that time. And bet you by the time you are even discovering that you are pregnant, this neural tube has already been formed. So if after that you get pregnant and you start taking folic acid maybe during the antenatal period, and you go and start your antenatal clinic, because many women usually think like you need to start your antenatal consultations 2, 3, people even go to the hospital at 4 months of pregnancy. So once you're going at that time, even you pump a higher dose of folic acid is not going to help at this moment. That's why folic acid is very important at the very early stage. And remember this, it is not only preventing neural tube defect. By the time you want to discover that you are pregnant, most of the organs of the body have already been formed. As the studies have shown that this folic acid is going to prevent neural tube defect by over 70%, and that's a good number. That's a good number. So most of these neural tube defects that are being present could be prevented by taking folic acid. Research has also shown that it can even prevent congenital heart diseases and even what we call cleft palate. So this folic acid, it has a multidisciplinary effect. So it's very important. Any woman who is out there planning to get pregnant, please start taking folic acid. Now you will ask me that how should you take this folic acid? Yes, the World Health Organization recommends 400 micrograms of folic acid daily till you get pregnant. And once you get pregnant, it's not like you stop, you continue taking, and you then go to the hospital to start your first antenatal consultation once you discover you are pregnant, and you still continue taking folic acid till delivery. Now there are some particular people that might have some risk factors that increases their chances of having children with neural tube defect. For example, if you have had a child before with this neural tube defect, you need to also take folic acid. And you will not just take like a person with no risk, you're going to take a higher dose. People who are obese, they will need a higher dose. People with diabetes, they will need a higher dose. But now, how will you know that you are that category that needs a higher dose, and what quantity will you need, or what dose will you need? So it's very important that not just going and buying folic acid. It's good you go and consult for preconception care, and you are actually evaluated for all other risk factors, and then they decide on what dosage you're to receive. Lastly, they always associate this folic acid with other micronutrients like vitamin D and calcium. This also helps in the building of the bones and making the baby grow stronger. So it's very important. Now the doses might depend on you, on your own risk factor. So it's very important that before you plan to get pregnant, go for preconception care. Let them evaluate all these risk factors and then decide the best dosage for you to take. Folic acid is very, very vital to all women out there planning to get pregnant. Please supplement with your prenatal vitamins, folic acid, and other micronutrients. Therefore, go for your preconception care. Now we are offering preconception care consultations. So if you want to we have a team who are trained on preconception care. If you want to have a complete package of preconception care, therefore click on the link below and you get to us. And don't forget to share this good news to other women out there, to other couples out there. And don't forget to click on that subscription button. Thank you very much, and God bless you.